just reporting on. Now, MedStar Ambulance Service in Fort Worth sends trained personnel to homes of patients who could have the virus so they can be tested without leaving their house and thus putting other people at risk. Sounds like a pretty good idea during hard times. And right now we turn to the spokesperson for MedStar, Matt Zavodsky, who also serves as president of the National Association of EMTs. Good day to you, sir.
Good day, Ari. Nice to be with you.
Appreciate you being with us. As mentioned, tough times, but a lot of people doing good and innovative work here. Walk us through what you're doing and for viewers to understand how different or not is it from a normal approach during, say, a non-pandemic, non-emergency period?
So EMS workers across the country are doing things that typically they don't do to bring more value and capacity to the healthcare system. So much like a lot of communities are doing, we here at MedStar in Fort Worth are actually screening callers on the 911 side to see if we really need to send resources to them or can we navigate them to their primary care physician. If we arrive on scene and the person has a minor medical complaint that might be COVID related, then we have specific instructions to give to them. We often don't bring them to the hospital. And these are all ways to help make sure that we're preserving the hospital capacity to be ready for that surge that will be coming through Texas here, much like you're seeing on the other coast.
Mm-hmm. What percent of calls that you're tracking, because you're on the front line of this, actually end up being actually COVID-related cases?
So today, we are dispatching about 60 to 70 calls per day, where presumptively on the 911 side, the 911 dispatchers at MedStar have indicated this patient's at risk for coronavirus. So the first responders are taking that extra PPE effort when they go in. About 36 calls per day, the crews have actually identified, yes, this patient has signs and symptoms that could be consistent with potential coronavirus, flagging that patient, managing them into the hospital a little bit differently, or again, in some cases where the patient isn't a significant medical risk, leaving those patients at home, giving them instructions on how to do follow-up care so we're not bringing all of those patients to the hospital.
Given your knowledge about this emergency responder side of it, what have you seen in the evolution of people's awareness? Obviously, we started with something that was in other countries, and people were learning about it over time as it got here. Now we're in a different phase where anyone who's not under a rock is hearing a lot about it. Many people obviously personally affected. How does that affect the sort of literacy, if you will, of people when they're calling in? And is it helpful that everyone knows so much, or are you getting some false positives at this point?
You know, it's interesting. Obviously, people are more aware of it, so they're very concerned about it. So we have seen the number of calls coming to 911 for patients who believe that they might be suffering from the coronavirus increasing, but our screening process has changed a little bit to be a little bit more inclusive and making sure we're capturing all of those. But honestly, one of the things that's happening is that with these shelter-in-place orders that we're seeing across the country, it's a very predictable pattern where the 911 volume actually will begin to decrease as people are staying home. They're not doing things that might be risky, causing car crashes or things that might happen. But then we see that wave come through. The good news is that things that were learned in Italy and Spain and China have been shared across the emergency medical services community. So we are much more prepared now than we would have been had this started here in being able to mitigate and manage a lot of those surge of calls that we anticipate coming within the next week.
Well, what you mentioned just now is very interesting because it's sort of the non-virus part. You're saying that because so much of actual daily life has temporarily shut down, you're actually seeing less other types of incidents, which is, it's strange. It's not a permanent thing, but sort of a benefit. You're saying fewer people hurt in car crashes. How much can you track that?
Yeah, so here at the MedStar system in the Fort Worth area, our response volume currently is down about 19%, which is relatively consistent with what is happening in a lot of other communities during this lockdown before the coronavirus really takes hold in those communities. The challenge with that is that now you get sort of lulled into a complacency perspective. This is the time that, like us and other communities, are really planning for, okay, we know it's coming. We use the term tsunami. Right before a tsunami hits, the water recedes from the coastline. We know it's coming. This has given all of us a chance to make sure that we can get the PPE that we need, to make sure that we've got surge plans in place, emptying out the hospitals as much as possible. Many of our hospitals in this community in Fort Worth are reporting about a 50 to 55% occupancy rate, which really prepares us well for that tsunami that we know is coming.
Really interesting stuff all around, and a lot of good work being done there, Matt Zavodsky. I want to thank you very much for joining our coverage today. When we come back, we're going to get into another sad part of this story, but an important one. The funeral homes across New York City that are overwhelmed as the death toll climbs. Funeral directors scrambling to keep up and honor these important last wishes of families, as well as the grieving process. We're going to get into all of that when we come back.